If you're pregnant and considering the flu shot this year, you better listen up. Hi, I'm Dr. Brittany Todd, and I am a pharmacist, and I would love to tell you the risks and benefits of getting the flu shot when you're pregnant. So first off, the CDC recommends that every single pregnant woman gets a flu shot, unless it's contraindicated, which is very rare. And it bases that recommendation off of observational data. The reason for that is we can't ethically do a randomized controlled trial in pregnant women. So we go off of what we can observe in our communities. So in 2013, a study came out and showed a reduction in influenza-like illness in pregnant women. And in 2018, they found a reduction in hospitalization from flu-like illness in pregnant women. Interestingly, in that 2018 study, there were 20,000 pregnant women hospitalized for some sort of infection. Only 6% of them were actually tested for the flu. And of those, only about 50% of them actually had the flu. So it was actually a very small number of women who actually tested positive for the flu. Of those who tested positive, only 13% of them had had a flu shot, which means that the other 87% of them either didn't have a flu shot or they didn't know one way or the other. So efficacy-wise, it does reduce the risk of infection from the flu. What are the risks? So the CDC even breaks down some risks when it talks about miscarriage. There was actually a study that showed an increased risk of miscarriage within the first 28 days of getting the flu shot. And that was statistically significant in this study. However, when they repeated the study with more women, they did not find the same risk of miscarriage. There are 4 randomized controlled trials that were not done in the United States. They were done in Bangladesh, Nepal, Mali, and South Africa. And all of those did find effectiveness of the vaccine reducing flu infection. However, it did find a 2-fold increase in pregnant women getting non-influenza type infections. Those included other fevers, respiratory infections, peritonitis, other types of infections. There was a 200% increased risk that was statistically significant in women who had the flu shot versus not. They also found a 36% increased risk of non-influenza type adverse events in infants born of those mothers within the first 6 months of life. So, the takeaway. Influenza vaccine does decrease the risk of pregnant women going to the hospital and being diagnosed with influenza. However, it increases the risk of non-flu type illnesses in both mom and baby, and both of those were statistically significant in these studies. So I just gave you informed consent, and now you can decide for yourself.